4th of July, the day America celebrates its independence. This year, it announced to the world that another victory was in the offing. Coronavirus was losing and America was winning.
We're closer than ever to declaring our independence from a deadly virus.
The White House threw a big bash to mark the country's return to normalcy. It was touted as a summer of joy and freedom. Masks were discarded, revealing smiles behind them. A month later, fortunes have reversed. From 12,000 cases a day in early July, the US is now reporting more than 150,000 infections and over 1,000 deaths every 24 hours. Over 100,000 COVID patients are in hospital in the United States right now. As a matter of fact, the US was among the first countries in the world to begin its vaccination drive, and over 60% of its total population has received at least one dose. So what went wrong and why? In this video, we'll try and explain the reasons behind the crisis and what the rest of the world can learn from the situation in the US. Reason number one is the spread of the highly contagious Delta variant, which has been sudden and devastating. The US CDC says that more than 80% of the total cases are caused by Delta. Infections, deaths and hospitalizations are rising across the country to a level not seen since last December. Apart from adults, the current wave is impacting children as they account for more than 20% of the total reported cases. As the developing world scrambles for vaccine, the US has had enough of them for months. But around 30% of the population just won't take them. And by the way, the government tried everything to win people over. Easy availability of jabs, lotteries, public awareness drives, and even a $100 cash handout. Yes, literally paying people to keep them alive. But some still refuse to see the writing on the wall, even from a hospital bed.
If you would have had a chance to get the vaccine and prevent this, would you have taken the vaccine?
Nope.
So you'd have gone through this?
I've gone through this, yes sir. Don't shove it down my throat. That's what's local, state, federal administration is trying to do, is shove it down your throat.
What are they shoving, the science?
No, they're shoving the fact that that's their agenda.
The rising cases and deaths have persuaded a few, but it's nowhere near the rate needed to achieve herd immunity. This reluctance has forced the federal government and many states to announce vaccine mandates that are facing resistance from unexpected quarters.
We don't want to be mandated to take it. Those who want to take it, we love them just the same. We want them to take it and feel safe. But for those of us that choose not to, we want to be able to have that right to say no.
To be fair, they may have genuine concerns regarding the long-term side effects of the vaccines, and that should be addressed. But what to do when someone is in complete denial?
There is zero evidence that COVID-19 exists in the world. PCR tests are recalled. This is a pandemic. Fake virus, bioweapon jab.
Though it's easy to blame people, but experts say that the part of the problem also lies with the Biden administration. The CDC in May came up with a surprise announcement. Fully vaccinated Americans were no longer required to wear a mask anywhere.
Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing.
The US president called it a great day for America, but doctors were not celebrating.
The whole idea was that vaccinated people can take off their mask, but if you're unvaccinated, you still have to behave as you did before. But what ended up happening was unvaccinated people also said, well, I don't have any restrictions on my activities anymore.
2 months later, the CDC reversed its own guidelines and advised vaccinated people to wear masks indoors and in public spaces. How do you plan to convince the public if your chief medical body is puzzled? Adding fuel to the fire are America's political divisions. The pace of vaccinations is strictly correlated to people's political affiliations, with around 40% Republicans are still hesitant in getting the jab, as opposed to 6% Democrats. After spending an entire year opposing wearing of masks, many politicians are now questioning the vaccines. Some of them actually endorsed the very same vaccines when Trump was the president.
And as soon as we get the vaccine, we're going to get out of this in a rapid fashion. And all I would say to government officials is let's get the vaccine out as soon as we can. We would want to know, is the vaccine more dangerous, or are you more likely to have serious side effects?
And that's not all. Both Texas and Florida have banned mask mandates in their states. The mistrust is so deep that some Trump supporters are not even listening to Trump himself.
I recommend take the vaccines. I did it. It's good. Take the vaccines. But no, that's okay. That's all right. You got your freedoms.
Individual freedom above public health. But at what cost? Over 600,000 deaths and counting. More than 1,000 people are dying each day. That's over 41 deaths every single hour. And many of them could have survived, only if they listened to the experts and took the vaccine. Breakthrough infections are a reality, but if you are vaccinated, the CDC says the risk is reduced by over 60%.
The primary reason for vaccination. So someone says, why should I get vaccinated? Well, because we don't want you to wind up in the ICU in a hospital. And I can guarantee you 99% that if you get vaccinated, you are not going to wind up in the ICU.
And yet, the pandemic of the unvaccinated drags on, with freedom from the virus seems elusive for now. And the lesson for all of us, it isn't over yet. So get vaccinated if you can, and please keep that mask on.